DeLauro, who's the ranking member of the Appropriations, Labor, Health, and Human Services Subcommittee, which has jurisdiction over funding federal mental health care and grants to states. And Congressman, thank you for joining us today.
Thank you very, very much. Delighted to be with you.
We've been having this debate around the table. We've been having this debate around the country. Are we not spending enough money on mental health?
We are not spending enough money on mental health. I too read that article that you just quoted, and it was it's poignant. Someone seeking help. I think it was on another news show yesterday where someone indicated that where you can purchase a military-type weapon, and I think that's what we're talking about in this instance. Much more quickly than you can access mental health services, we need to confront this issue and make this part of the national dialogue as we are addressing the serious issue of violence. For me, this is my response to what happened. In addition to how overwhelming it is to see the slaughter of innocents, which is what happened in Newtown last Friday, but it is about military-type weapons and a ban on assault weapons or the high-capacity magazines. It is about background checks, but it is about mental illness as well. And the focus, that needs to be on parity in the discussion today. There's so much talk about arming our schools, turning them into fortresses. I would like to, I believe in the safety of our schools, of the physical structure of the school. But in addition to which, why aren't we talking about putting trained mental health professionals in each one of our schools as part of the nurse's office, where someone who is well trained, who can recognize symptoms, or can be having conversations with youngsters on a regular basis, being able to engage with parents on what is going on in the minds and lives of their children.
Congresswoman, my gut instinct is the same as yours, this idea of the assault weapons ban. It seems to me like common sense, but our guest host, Larry Lindsay, is just laying out, there was a study from the Department of Justice, or from the Department of Justice.
I think it was Justice, yeah.
What did it find?
That the ban was ineffective. It had to do with definitions of what the weapon was. By the way, I am very sympathetic to what the Congresswoman's saying. But if we're going to link the two, then don't we also have to say, will those mental health professionals be able to report the people that are troubled to? I mean, I am all for banning. In fact, we now have a ban that if you have a mental health history here or criminal history, you can't get a gun. Okay, well, I think that's a great idea. So are you going to let
that history, Larry? But the fact of the matter is that people are getting around that, and I don't know about the Department of Justice study that you are talking about. Clearly, one of the ways in which people could get around the ban was with regard to the definition of what constitutes an assault weapon. But that needs to be debated and discussed, and we are talking about military-type weapons.
But can we agree that if someone one of the mental health professionals finds someone has a problem, that they can actually report that problem to the police?
Well,
that would seem to be an important step here.
Let's step back a second in terms of if we find that a youngster has difficulty, the issue is how to prevent that. What kind of treatment should that youngster be getting? You seem to move in the direction of calling the police. We have very trained, very professional. Look, I'm from New Haven, Connecticut. I have a wonderful asset in my community called the Yale Child Study Center. And I was there yesterday with Dr. Stephen Marins and Dr. Volkmer, and we were talking about how, in fact, we need to use these facilities that we have that have trained personnel. What kind of treatment would a youngster need in order to be able to address the mental health problem that he or she may have? How do you help the woman who writes this story about pointing her in the direction of where she can get help? The answer isn't whether or not you take this to the police department, whether you stigmatize someone with mental health illness.
But should a young man in Idaho ever be able to buy a gun?
Well, that was part of what we were doing in terms of the vetting process. And
right. So
the
are we going to be
background
able to
checks,
vet people?
That links. Well, we're supposed to be looking at background checks and the effectiveness, I would imagine, of that system, where there are a lot of loopholes. And look, I see it every day, the way we want to skirt around some of the efforts that we have to.
But Congresswoman, how can you do a background check if the mental health professional can't report the person? It never shows up in the background check.
It's when you go to buy and purchase, you know, first of all,
so I go and buy and purchase a gun, and I visited one of these.
If a youngster is going in, and I'm talking about children at the moment.
A kid can't buy a gun. We agree. So this young man grows up to be 23 years old with this history.
No, he was 20. He was 20 years old, not 23.
Well,
and in fact, he took the guns that his mother had that were registered. Let us get the facts correct.
No, we know
ma'am.
No one's saying that he's not. He's talking about it. If
I'm hypothetical.
Hypothetical. Just listen.
If the person in Idaho who read that story, should that young man who's now 9, when he is 23, ever be able to buy a gun? I would say no. But the only way we're going to be able to have the background check work is if, in fact, the mental health professional can report this incident to the database that has those things.
Why is a background check that doesn't work?
But I understand what you're saying, and I think there is a way in which we can, and we need to be talking to the professionals in this area about how one does protect an individual's privacy, at the same time be able to address the problem of mental health. And if you, the issue, what is the incident of a youngster? What is symptomatic about a youngster where they can get the kinds of treatment that is necessary to address the problem that they have?
So here we have two rights that we're comparing. You're for taking away Second Amendment rights, which I can understand part of that.
I am not.
But don't you think we have to balance that against the privacy rights of mentally ill people being able to get guns? I mean, that seems to me a much more directly related problem here.
Well, it is, but I am not, and please do not put words in my mouth. I am not trying to bridge people's Second Amendment rights. I am saying that the military-type weapons, the type of weapon that was used in Sandy Hook last Friday, in my view, should be banned. That is not I don't believe that abridges someone's Second Amendment rights. The high-capacity magazines do not abridge people's constitutional rights. And I think you're seeing more and more people on all sides of this issue come to the table and say, let's reason together and look at how we avoid this situation in the future.
Congressman, we're going to have to leave it there. This is a conversation that, of course,